Okay. I think we will make a start. It's 12:02. Welcome everyone. Welcome to Open Data Saves Lives. This is a series of events we've been running, kicked off in COVID. For those who are joining for the first time, we were actually running weekly events through COVID, and in a very sort of aggressive pace of just trying to get data as quickly as we could. They weren't issues that we were wrestling with that could kind of wait a month or two for information governance committees to meet and data sharing agreements to go through 14 different people. And we made some really interesting progress during COVID of getting people to kind of proactively share information and resources, which went really well. On the back of that and the COPI notice, which came out at the time, encouraging people to share data, we had the Goldacre review, which again has emphasized the need and the opportunity around proactively sharing data. So kind of anything that you do, there is a risk in the NHS, and I'm sure in other industries, where it gets done in a couple of places, but is not really rapidly accelerating. So we're here, that is our space to try and encourage kind of fast innovation, or open innovation as we call it. Open source isn't new as a concept, open data is not new, but kind of getting people together, proactively sharing really quickly is quite new actually, and getting us beyond silly conversations sometimes about IP existing within things like the NHS, where these things are not IP. These things are all to be shared, and the kind of measure of success is how many people are using these things. So we're actually talking about some sort of an idea for next year, maybe even a prize where the person whose code has been used by the most other people gets some sort of recognition. So really grateful for you all joining. We've got two fantastic speakers. And we're doing it, Sophia and I are kind of chairing this together and doing it as kind of two sections. So kind of how you get the data, how you share it, how you reproduce what you're doing and make it available to others, which Sam's going to lead on. And then we're going to go to Molly to take us through some examples of the results of some analysis. And the challenge for all of us in that is, if this looks useful to what we're doing, how do we get everyone doing it super fast, rather than kind of going, oh, there's a guy over there who did a bit and someone over there. So that's a challenge for all of us. So we're just before 5 past, so hand over to Sam for the first session. If you're happy sharing your own screen, Sam, just go for it.
Awesome. Let me just remember how to do that. Yeah, I think it's this one. Hopefully everyone can see that okay.
Yeah, I can see that.
I was just going to try and see if I can get the chat window. Oh, there we are, cool. So I can try and live answer questions if I'm that clever. But yeah, obviously I agree with everything Mark said, particularly around sharing what you've made and then reusing it, which is a core part of this whole thing I'm going to talk about. So yeah, I'm going to describe, well, I'm Sam Hollings. I'm a principal data scientist in NHS England now, although it was NHS Digital until recently, so you may see me occasionally say that as like a slip of the tongue. And I lead our RAP champion squad, and so I'm going to talk to you about reproducible analytical pipelines, or RAP, and how we've benefited from them in NHS England. And I guess how you could benefit from using this sort of approach as well. So, how do I define that? So what is RAP, and why should you guys care? So I like to start off with a striking quote. So analysis that took 2 weeks to do now takes 40 minutes. That's from one of our analysts about one of their pipelines, which they've rapified. If that wasn't clear enough, the benefits of the reproducible analytical pipelines approach are, well, they're twofold. For the organization, you get faster analysis, it's more robust, it's more reliable, and it's more resilient. It's easier to make changes to the analysis, and the analysis and the QA are more transparent. But then also, it benefits our colleagues because, you know, their work is less manual and repetitive. It's less stressful to do it. And the analytical processes are easier to understand, and they're getting valuable new skills like Python and code version control. However, crucially, there's more time for analytical work, less time cranking the handle, more time analyzing these data and getting those actionable insights that we all want. So it's important to lay out the sort of the problems that we face and why RAP is therefore important and why it's actually solving something, why you should spend your time on it. And so, at least in NHS England, and probably many other places, we have a situation where we have our legacy processes are often quite manual and inefficient. So that you have people copying and pasting things around, or, as I said, cranking the handle on some manual process. They're often quite expensive because they might use licensed software. It's quite repetitive. So you've got different teams doing the same actions again and again, or making a process that did the same task as what some other guys did. And it can be quite opaque. So it's difficult for our stakeholders, customers and patients and taxpayers to understand what's actually happening to their data. So RAP offers, solutions to all these things by automating those old processes with open source tools that are free and easy to get. Sharing and reusing what was made, so making it reusable, and then actually sharing and reusing that, and using tools like code version control and software dev good practice. So we can get more utility out of the code that's already been done. And finally, making it all more transparent and easy to understand by having a standard structure, well documenting stuff, and just publishing it so people can see what's actually being done. And I want to point out that RAP is a cross-government effort, so it's not just us doing this. It's it's used across the civil service, the NHS, other bits of government, and into the research sector. And for example, on the government data science Slack channel, on the RAP part of that, there are about 500 people in there posting and talking about stuff. The government statistical service has made guidance on RAP. We've got the quality assurance of analytical code, quality assurance code for analysis and research. We've got guidance on RAP. Government blogs about RAP. We've got the Goldacre review that talks about RAP a great deal. So it's the minimum standard for academic and NHS data analysis. RAP should be the core working practice that must be supported by all platforms and teams. It should be used for data curation, and the researchers should be learning RAP and doing that. And data controllers should require RAP and open code sharing from data users. And the TREs, which is the data platforms, should be built on the principles of RAP and open code. And we even have MPs asking each other about RAP. So here, this MP has asked, okay, well, what are you doing about RAP? And the other MP has responded, we're doing it in these ways. So people are interested in it. So now at the scene, I want to talk to you guys about how we got on with RAP in NHS England and the challenges we faced and how we overcame them, because it wasn't just all sunshine and roses. So, here's the first NHS Digital that I forgot to take out. But the challenge of RAP in former NHS Digital. So we had some pipelines that were already, very advanced and, written in Python, all automated. Things were flowing right through. That was great. One of the issues was it was difficult for our analysts more broadly to pick it up. Because it's great having an exemplar, but if it's impossible for everyone else to replicate that, then we're not in a much better position, really. Some of the reasons behind this were the fact that we had many different tech stacks running concurrently, and some of them were quite manual. So we had people using Python and R, but we also had people using Excel, SAS, SIS, SSRS, SQL, and often things weren't totally joined up. There was a lot of copying and pasting stuff between things, and yeah. What's more, many of our analysts didn't know getting Python, and they were just very busy. So they didn't have all the time in the world to start from scratch and learn it. And to compound that, we had a lot of publications, like 140 to try and improve, and hundreds of analysts. And so there was a lot of barriers to entry for these guys to achieve what some of the teams had achieved and what we wanted to achieve. And even though it turns out they totally had the potential to do this, without the right support, people can be feeling demoralized and just they can't get past that point. For example, yeah, if you just dumped a textbook on their lap and said learn Python and then implement it, it will be really difficult. So to help combat this, we created a central RAP squad, which was a squad of data scientists set up to, one, make RAP achievable, so to break it down into chunks so that our analysts knew where to start. Two, to create, maintain, and curate RAP resources, specifically guidance that was really more specific to our systems and context. And then next, to champion RAP in the organization, so to go out to teams and sell the benefit of RAP, take it to them, and even better, publicize those that have already done it and their great work to lift them up. We also crucially wanted to train people in actually how to do RAP transformation. So to guide people down that path of RAP, and to hopefully a few of those people would themselves become RAP champions and train other people and keep it rolling. And finally, and this is really important, is just to be a point of support. So ultimately during any process of change, people they like to have someone that they know that they can go to for questions, the stupid questions, anything. It really, really helps people. So yeah, I mentioned that we wanted to wrap up into chunks to make it more achievable. So, sorry, I'm just reading some of the questions. I'll answer those in a bit. So if you look at the government data science, if you look at the government RAP strategy, it outlines loads of things that RAP contains. And, open source languages, code version control, fully automate outputs, make sure the code's well documented, tested, all the rest of it. And these are all wonderful things that we definitely want people to do. However, it can be a bit overwhelming to see all of this at once. And the government RAP strategy does helpfully break it apart into essential and extra. But even that extra part has got quite a lot of stuff in it. And it can be hard for people to know what to do first, or if they've already got somewhere, what to do next. And so we sort of firmed this up a bit by very clearly breaking it down into these three levels of baseline, silver, and gold RAP. Sort of RAP in 3 easy steps. And then even better, we reduced it to 1 step, which is we just told our analysts to focus on baseline RAP. So prioritize this, just get your stuff using open source languages, code version control, publish the code, peer review it. And the reason why we focus on this is because for most of our analysts, for most of our pipelines, this brings most of the benefits. So this is automation, making stuff faster, getting the code out there so people can see it, and just doing this gets loads of benefits, and it sets you up later for then improving the code, making it more robust and more reusable and getting even more benefit out of it. But this just helps them have a clearer starting point. So now they know what they're aiming for, but how do they actually get there? So that's where my colleagues spent a lot of time thinking about how to implement RAP and how to train others. And so they came up with a process they called the thin slice strategy, which our website has got a whole page on how this works. But basically, a couple of my colleagues spent about 2 months training up maybe 4 or a bit more analysts. So they would take the old process and they would then, my colleagues principally would transform that process into a so-called thin slice, which is they would take the old process and maybe using Python or Git or however we were going to do it, just make one part of it, one measure, one breakdown, test it, get it working end to end. And then we would show the analysts this and train them about how we'd done it. And because they were seeing, because it was being done on something they knew, a process that they understood, it made it just a lot easier for them to understand what Python was doing and why it was important. And so we showed them how this worked and made sure they understood it. And that took up much of the first month, really. But then the next part is where it really gets good, because then we said to the analysts, okay, finish off the publication, do the rest of the breakdowns, do the rest of the measures. And Obviously, the analysts had a go, they fell down, we helped them up again, they wrote some code, we reviewed it, we iterated it, improved. And by the end of the second month, they were pretty much working on their own, reviewing each other's work, finishing this off, and we could proceed to help a different team. And again, because they're working in an environment they feel safe on something they understand, like intrinsically, because they've worked on the process before, the only thing they had to learn was how to replicate that in Python, and we'd already given them a template for that. And so yeah, it's been very successful. And importantly, after this, they then would try and go on and try this with their with their colleagues, like a do one, see one, teach one. And so as an example of how this sort of actually played out, here's a sort of pipeline that we engaged with one team and they had. So they had some data in a SQL server, then they would manually by hand run a bunch of SQL scripts. Those SQL scripts would deposit some results in the SQL server, then they would manually copy and paste that into Excel, then they would manually mess around with Excel to get that in the format it needed to be, and make some CSVs, and then they would put that on the website. And so obviously some of this is automated. Those SQL scripts run and do a lot of analysis or whatever, but there's obviously a lot of manual steps too. And so to get these guys didn't really know Python at all. Like, it was totally new to them. So to get the most bang for their buck and to get them forward the quickest, we just helped them initially transform all that manual stuff with Python. So Python would parameterize and run those SQL scripts, and then get the data out of the SQL server, and then make the CSVs. And so then it went from having to do like 6 manual steps with lots of checking in between, and then people having to like, check what been checked and all the rest of it, to just someone pressing go, and then you have the output. And so those guys saw a lot of benefit, and they're now applying this to other pipelines. And then later on, they'll be able to take this, find the common elements, improve those, and it goes on and on. I'm almost near the end now. So what? Like, what's the, who cares? Well, hopefully we all care, because the analysis runs a lot faster now. So for one pipeline, it's gone from, and this is pretty incredible, but it used to take them 2 weeks, and this is factoring everything in. So getting the data, messing around with it, checking it, having someone else check what's been done, all the rest of it, down to 40 minutes. How long it takes them to create their output. And for others, it's like 3 days of manual work down to 1 hour. Things are more reliable as well. So, because each component is tested and understood, and automation limits human error. And finally, it's a lot easier to update these pipelines. So because it's all coded and documented better and laid out in a way that they understand more now, because they've taken ownership of it, changes and revalidation of one pipeline only took a few hours, when previously it would have taken at least another half a day, is what the person said to me. And yeah, the final conclusion slide. So, our analytical tribes are actively engaged in planning RAP, which is great. Our senior leaders take RAP seriously, because we spent a lot of time pitching it to those guys as well. I think our analysts feel more valued because we've invested in them and given them the tools to improve their own situation. And they understand the benefit back to them. And then, we've got 12 publications that have been published in the open, 37 pipelines that are very near to that. And then we've got RAP skills sprinkled across the analytical teams. And yeah, we've got a website full of lots of guidance that you should check out. And yeah, that's it. So I want to thank my team members, the previous colleagues, especially Connor and Helen, that did so much work in this started it up before I even joined this team. And then we've also got a great website you should check out that we update all the time. And definitely check out LinkedIn, because we try and put this stuff in context on there and explain more about, how you can get started or what you should look out for. So that's me.
Sam, that's fantastic. Thank you. So a couple of things from me, and there was a couple of questions in the chat about links. So those links there are really, really helpful. And I think there are some from Taz, which are on the Open Innovation site, which we can kind of top up as well. So we should be able to get plenty in there for Alicia and Suresh. a couple of questions for me to start, and then see if we've got any others. You sort of alluded to it on that last screen. I'm really interested in the thread between the improvement in outcomes from what you've done and sort of measuring the effectiveness of this. So for some of those senior leaders and for some of those senior analysts, presumably, are you at a point where you can start to quantify, we are now able to do this that we weren't used to. This takes 2/3 of the time it used to, and so on. Does that start to exist?
I'll be honest, we're still sort of getting good at quantifying this, because I guess our current publications vary a lot, like, and so the processes for making them are quite varied. It's almost like, how do you get so currently we're sort of leaving it to the analysts to say, okay, we think it took this long and now it takes this long, like, and so we are starting to gather that. We have what's called a benefits bank, where we're getting people to record where they've seen benefit and you know, all that. But it's not like, so in terms of tracking the whole thing, we have a big spreadsheet basically where we have all the pipelines and what level of maturity they're at, and you know, where people are getting stuck and how we can help them. But currently we haven't so much said to them all, okay, how long does it take currently? And then how long does it take after? Because currently we've sort of, well, at least my team have left it to the analysts to know that, I guess. Like, but it's a good point. It's definitely something we need to capture more and make a bigger use of, because I'm fortunate because I haven't really had to sell RAP in the organization as much as you might think, because, you know, Ben Goldacre was one of our directors, and you know, there was a general desire to do it, like, and so we did have to pitch it to teams, but yeah, I haven't had to focus on proof as much as you might think, but it's something that I should put more effort into, because loads of our colleagues do have great stories to tell now. Definitely.
Yeah, I think it's a sort of build it and they will come model, isn't it? There's a few questions in the chat. Sam, I don't know if you want to come off mute and ask, or you just have a look. The question there about GitHub.
Let's have a look. So what opportunity? So yeah, I'm just having a look back. So what opportunities does RAP channel mean? We can start cross reference. So first to Sophia Christie, so Slack. I mean, the government data science Slack I find is a really helpful space to talk across the sector, because I mean there are other spaces like that. So there's the NHS Python community Slack, there's the NHS R community Slack. I'm sure there are other spaces as well, but I think they're definitely useful for things like getting consistent reference data and, you know, these cross-department initiatives, so we can build once and use many times. That's the sort of motto of a lot of this work, because the less time we spend coding, the more time we can spend analyzing results and making a difference to people.
Do you, just on that, Sam, does it feel like it might compartmentalize into big areas? So there's something, what Sophia's alluding to is you'd have different, you know, postal geographies and things like that. So you can imagine a whole kind of library space around aligning geographies. Another one would be how you align clinical data. So the use of read codes, SNOMED CT, ICD-10, OPCS4, and so on. And there will be organizations that record frailty or COVID slightly different to one another. And I wonder if you think it might land like that. So you might start to have kind of areas of expertise where you go into for RAP around, you know, aligning boundaries or aligning diagnosis categories. Or
yeah, it's a good point, because we're not of NHS England, maybe it's NHS England, but there is a group called the Interoperable Dataset Design Collaborative, which I'm pretty sure think about these sort of things, like, and so I think, yeah, the government data science, like, despite being called the government data science, like, has got channels on many different aspects of using data in the public sector. So I'm sure there is a community of people there that are interested in these things. Like, and if you just Google government data science community, you can get the details of the Slack there.
Okay, we'll just take one more and then I'll hand over to you, Sophia, if that's all right. There's a question there from Neil, Sam.
Yeah. What if I'm just translating those other into Python to automate? So Neil, I guess why would you bother translating something that's already been made in SQL into Python? It's a good question. And I guess the main reason is there's a few reasons. One reason is the less languages we use, the more reusable stuff is. So initially, keeping it in SQL is helpful because the analysts know SQL better. But eventually, when everyone's using Python or whatever, whatever is prevalent in your business, I guess you can just get more reuse out of something if it's in the same language as everything else. Additionally, languages like SQL they don't really play with a lot of modern testing frameworks. So I think if you want to take things higher up and make like reusable functions that you want to share or publish to like a online repository like pip or something like that, or cram to R, it needs to be in Python or R. So basically you can get more utility out of Python code than you can out of SQL code. However, the sheer just crunching the numbers, the SQL's fine.
Thanks, Sam. Okay, I'm gonna hand over to Sophia. I think the Open Data Saves Lives stuff has been quite fluid in how it's developed, deliberately so. But I think two areas that we've kind of kept landing on is the use of RAP and a focus on inequalities. And almost every session that we run kind of comes back to one or both of those, and it feels like, for better or for worse, that's going to be our kind of space in the sky. So I'll hand over to Sophia. So hopefully we've introduced RAP. I think the challenge for all of us is how we use that and apply that against things like inequality. So I'll hand to Sophia to introduce the next section.
So just before we leave Sam's bit, what might help as a transition is Alicia asked a question, Sam, about is there an example of a RAP project you can share some details on? So maybe rather than the details, can you just give us a couple of examples of some of those processes which you've talked about? Maybe the one that used to take 2 weeks and that's now only 40 minutes. What was that process? Is it something that people in the system would recognise? So are they kind of core processes that we should be naming and getting out there?
Yeah, I mean, I'll keep it brief, but I can't remember exactly which process that quote came from. Actually, I'd have to go check back in my notes. However, I've shared a link to one of our GitHub pages where we publish all of the code for each of the processes we've done. And so some of them, like the National Diabetes Audit, have rapified their pipeline, and so that's greatly sped up now. Smoking, drinking and drug use report also rapified. Workforce absence rates, that's been rapified. And National Child Measurement Programme and the IAPT patient outcomes data. There's adult social care user survey. Like there's a bunch of important pieces of work that have been rapidifying.
That's really helpful. Thanks, Sam. And that's a nice transition, I think, into Molly, because it sounds like some of the data you're talking about there isn't traditionally kind of it's data that feeds into kind of qualitative and social context data, as well as some of the harder edge stuff. So understanding the way in which the kind of pipeline process can really help streamline that is really important. So we're going to hear now from Molly Broome. Molly's an economist with the Resoultion Foundation, and she's been working on impact of the cost of living crisis. And what would be great, Molly, is to kind of hear a bit about what you found, but also for this audience, kind of how you went about it, and particularly how others could then go about it to really build on the work that's going on and understand the kind of local impact of that. So, Molly, go ahead.
Thank you very much, and thank you for inviting me to share some of our research findings. So I guess for a bit of context, I was invited to share the research findings of our report that was published last week, which is called Hoping and Coping, It's available on our website if anybody wants to read it in more detail, because we won't be able to share every single chart with you today. But it's been very kindly funded by the Health Foundation, and is part of a sort of wider programme of work where we're undertaking regular surveys with YouGov of 10,000 people to understand how people have experienced the cost of living crisis so far. So our first survey of 10,000 people was done in November, and our second one was done at the beginning of March. So these surveys have been really helpful for two reasons. Firstly, it's enabled us to sort of understand how people have coped throughout the winter, but it also provides much more timely data than typical sources that we would rely on at the foundation, such as ONS surveys, and which come with a bit of a lag. And given the sort of changing nature of the cost of living crisis, I think it's really important to have a sort of much more up-to-date picture. So I'll just share my slides, if I can find them. Okay, did everyone see that okay?
Yeah.
Okay, brilliant. So yeah, I'll just go through some of the main findings. So we looked at sort of how families were coping over the winter, looking at different coping mechanisms that they used, but also at the end turning to some of the sort of wider impacts on different individuals, whether that be through sort of food insecurity and health outcomes. So I'm sure the latter bit is probably what people on this call are more interested in. So as this chart shows, we all know that the country's been experiencing an inflationary shock. We still had double-digit inflation in March, with the headline rate standing at 10.1%. So while there's been a lot of talk around wholesale energy prices coming down, and we're coming out of the end of the cost of living crisis, in reality, families in the UK are very much still in the midst of a cost of living crisis, with this high inflation bringing down the real value of earnings and most benefits. So given the fact that we're still in a cost of living crisis, it's important to understand how people have been able to respond and its impact to date. So our overarching finding from the survey was that the vast majority of people have been affected by higher prices. 3/4 of our survey respondents reported that they'd cut back on their consumption over the winter. But this chart shows the inverse of that question. So those that reported that they didn't need to cut back. And the results suggest that there are some groups that have perhaps been a bit more insulated from the crisis, particularly richer and older people. As you can see here, 22% of those in the top income quintile and 29% of those aged 75 and above said that they didn't need to cut back between December and March. And again, this clear income and age gradient indicates that maybe young people and poorer people have had a worse time this winter. So in addition to cutting back, there are other coping mechanisms that people have used to get by over the winter, with a lot of people reporting that they'd use their savings. So almost half of our respondents reported that they'd use their savings to make ends meet over the winter. And again, we can see that from this chart, richer and perhaps older individuals are slightly more insulated from the crisis, as they were the least likely to report that they had used their savings to make ends meet over the winter. So another way to balance day-to-day expenditure is to take on debt. And this chart shows the percentage of our respondents that used formal lending, such as overdrafts and credit and any other formal loans to make ends meet. And as we can see here, it's, well, 1/4 of all our respondents suggested that they used this sort of formal lending to make ends meet over the winter, but we can see that the younger middle age, so those aged 35 to 44, were the most likely to report that they'd use this type of this coping mechanisms to get through the winter and the cost of living crisis. And then another way to get through the cost of living crisis is it's not another way to get through the cost of living crisis. We've had debt in terms of people accessing credit, but from this chart we can see that younger and poorer people who tend to be more credit constrained, so find it a bit more difficult to access those formal types of lending, have actually not paid their bills at all. And so this chart shows the percentage of respondents that have reported missing 1 or 2 bills between December and March. And again, from this chart, we can see that younger people were much more likely to report that they had missed their bills, with 20% saying that they were behind on 1 or 2 bills. And again, I've not got the chart for this, but again, this outcome is much more common among those from lower income groups, with around, again, 1 in 5 people, of those in the bottom income quintile reporting that they were also behind on 1 or 2 bills. And I think this is really important because generally this type of debt compared to formal lending is considered to be much more worrying, because there's lots of evidence suggesting that falling into arrears can lead to sort of negative outcomes, both in terms of your finances, but also emotionally as well. And then another common coping strategy used over the winter was people asking for help from friends and family. And again, we can see that younger adults were much more likely to do so, with around a quarter of those aged 25 to 34 reporting that they'd received some financial help from family and friends. And there's a bit more analysis in the report, but we find that the bank of mum and dad is really important in this context and has played a really important role in supporting young people through the cost of living crisis in the past year. For example, over 2/3 of those aged 25 to 34 who received financial help reported that their parents were the source of that financial help. So moving on to some of the outcomes now, despite the different means that people have used to get by over the winter, be that cutting back on consumption, drawing down on savings, or asking for friends and family for help, for some adults, it's just simply not been enough to prevent significant hardship over the winter. This chart shows that around 8% of all our respondents reported skipping meals for 7 or more days in the past month, and 3% had reported that they'd used a food or warm bank in the last 4 weeks. But you can see that these figures double for poorer people, which is perhaps not a surprising finding, but it's quite a shocking finding. And again, older and richer people were much less likely to report either skipping meals or using a food bank. So again, suggesting that they're perhaps a little bit more insulated from the worst of the cost of living crisis. And then, so moving on to some of the health consequences, which I'm sure is of more interest to people on this call. So food insecurity is not the only negative effect that the cost of living crisis has had. It's also affecting people's health too. And we show this in 3 ways. So firstly, we show that respondents that reported that their financial situation was now a lot worse were also much more likely to be experiencing negative health outcomes. So overall, 30% of our respondents stated that their health had been made worse by the rising cost of living, but this rises to 71% among those who reported that their financial situation was now a lot worse, and 77% among those who were finding their debt a heavy burden, or those who we classify as people that are in problem debt. And again, this echoes the finding from other organisations such as the Money and Mental Health Policy Institute, which finds that half of people in England in problem debt also have a mental health problem as well. Secondly, this chart shows the percentage of respondents that said that their health had got worse by income and age. And again, we can see that lower income individuals and younger individuals were much more likely to report that their health had been made worse by the rising cost of living. So they're 35% of those in the bottom income quintile and 40% of those aged 25 to 34 reported that their health had been made worse by the cost of living crisis. And then finally, we did a bit of analysis looking at how there's sort of correlation between people's mental health and the coping mechanisms in which they used. And we found that those who resorted to more extreme coping mechanisms over the winter were much more likely to report that negative wellbeing outcomes. So, for example, on this chart, it shows that 14% of all our respondents reported that they felt unhappy or depressed much more than usual between December and March. But this rises to 29% among those who had fallen behind on one bill, and as high as 45% among those who were experiencing severe food insecurity. And then finally, I put this in because I thought it might be interesting. We did a separate piece of analysis which looked at how housing had affected people's experience of the cost of living crisis. That report is called Trying Times. It's also on our website if people wanted to have a look. But this shows that housing quality is really important to people's health. So the chart shows that there's a link between poor housing quality and both general health and mental health. But we can also see that housing quality is also affecting how people have experienced the cost of living crisis to date. So as you can see there, almost half of people in poor quality housing reported that their health had been made worse as a result of the money that they were having to spend on heating, compared to 22% of those not in poor quality housing. So the sort of situation you find yourself coming into the cost of living crisis also has a bearing in terms of how you may have experienced the winter. So to summarize this presentation, I know it's not the most perky presentation, but cost pressures have affected everyone this winter, well, almost everyone this winter, and the way in which people have been able to respond with these cost pressures have varied significantly across groups. The high levels of income and wealth inequality coming into the cost of living crisis has left younger and poorer groups particularly exposed this winter, while richer and older people appear to have had greater capacity to respond to the inflationary shock that we've all been living through. This piece of research showed how people have experienced the cost of living crisis to date. And as I mentioned at the beginning, there's lots of talk about how we've through the worst of it, wholesale energy prices are coming down, inflation is expected to fall in the latter part of this year. But unfortunately, the cost of living crisis isn't going away, as families will still have to cope with a permanently higher price level, meaning that it's still really important to carry on this program of research and tracking how people are continuing to experience the cost of living crisis. And with that in mind, I think we're planning to do one more survey of 10,000 people later in the year to understand, again, how these cost pressures are changing. So thank you.
Thank you, Molly. So Paul's leapt in with a question about whether that data's available publicly. And I guess the kind of bigger question behind that is, so are there elements of this that this audience can start to reproduce or find out local variations on?
Yeah, unfortunately, the data is not publicly available. I need to check what our sort of agreements are around sharing it, but it's definitely something I can get back to you on. But yeah, as I mentioned, we've published 3 reports now using this data. So we did a Living Standards Outlook in January, which used the data from November. We've done Hope and Coping, which is the findings of this report, and we also did our Trying Times report looking at housing, and there's lots of information in there, lots that I didn't present. So there may be interesting findings that you're able to draw on. So yeah, I'd encourage people to go and look on our website for those 3 pieces.
And Mark, I think you're signalling that some of the issues, particularly around the definition of different data sets, might be useful. Do you want to ask anything more about that?
Yeah. I mean, the spirit of these sort of sessions is, Molly, is what can other people quickly pick up and do themselves. So just apropos of no example, you know, where you say poor quality housing, is that a government definition, or is that one that you made up, or is that one that you would share, or does it link to IMD, or does it?
Yeah,
does it link to,
no, it's a really good question. And for this particular survey, there's a general accepted definition of poor quality housing from the English Housing Survey, which is an ONS survey, and that is done by a surveyor. So they'll go into someone's house and report whether there's sort of structural issues. But unfortunately for this survey, we couldn't send a surveyor into our respondents' houses. So for this one, we used some questions in the FRS, where the Family Resources Survey, which is another ONS survey, and they have a variety of sort of deprivation questions, which they ask people, and we used 3 of those. So those were whether you live in a damp-free home, whether your home is in a good state of repair, and whether your heating and electrics and drains, etc., are all in a good working order. And people that said no to all 3 of those questions were considered to be in poor quality housing. It's not a widely accepted definition, but we thought for this piece of work, it was a useful definition, and it could be replicated, and we could compare it to the Family Resources Survey as well. So yeah, that's something that people could take forward and do some comparisons to the results in our survey as well.
Yeah, so I could say I wanted to run a survey in Margate. I could easily pick up your methods and survey design and so on, and run it myself within reason.
Yeah, of course. And if anyone was wanting to sort of run their own survey, I'm very happy to talk through the questions that we included in ours, and give advice in terms of some of the sort of issues that we came across and how we thought about designing questions to make sure that we got the most accurate answers from our respondents.
Yeah, that'd be amazing. I mean, that's an interesting point, because that, back to Sam's presentation, it's that I think what Sam was saying is there probably is a slight overhead in making something reproducible, but you're kind of making a bet that for the greater good, you know, the next person who picks this up. So it's really kind of you to sort of say people can contact me and I'll help them.
Yeah.
If as well as that, if you've proactively put everything out there, we can pick it up and run with that without even needing to bother you.
Yeah, exactly.
That's what we're trying to get to.
Yeah, and all our definitions of how we've sort of defined poor quality housing should be in the report, in our chart notes of various things. But yeah, if there's anything that people can't find, do contact me and I can talk them through it. And it's a good reminder that it probably should be in our chart notes. So yeah, do get in touch.
And that sounds like a good example as well of where we can help shape and improve the intergovernmental department Slack discussions, thinking back to what you were saying, Sam, like beginning to demonstrate that definition of poor housing is being used, and feeding that into the departmental groups would be helpful as a way of beginning to get more consistency across a wider audience. We've got a question from Anzir about, is any of this data geolocated?
So whether that's in terms of do we have the sort of regional data of where people are? So I think we do have regional data. Unfortunately, it doesn't go down any further than that. We haven't really, I think we did present some data in the housing paper, looking at housing quality by region, but it wasn't a main focus for the Hoping and Coping report, because we tended to focus on age and income for that. And when you add age, income and region, sample sizes tend to get a bit small. So that was, a sacrifice that we had to make. But yeah, we did ask regional information, there is some analysis in our report looking at housing quality for that. So it is worth having a look.
And can I ask about that decision to group age and wealth together? Because I can see the logic around wealth and the subsidies that were going into age, but some of your findings are surprisingly high in terms of the problems people were experiencing, even within, what you were describing as that richer group. Within a richer group, having 2% of people skipping meals, or 30% of people experiencing issues with managing their heating, that still seems pretty high. So have you got a sense as to the extent to which that was more driven by the age element, or is it that this crisis has been so significant that even people who would usually regard themselves as quite wealthy have been keeping the heating off for 12 hours a day? That would be me.
Yeah, I think that was in general, it was a surprising finding that particularly older age groups tended to report that they weren't having to use these coping mechanisms to get by over the winter. I think we were surprised by that, just given the sort of focus that government has put on these cost of living payments for pensioners. So, but I guess the context for this piece of research was we did an intergenerational audit looking at sort of the ways in which people might be coming into the winter, maybe having a difficult time. And we found that generally older age groups tend to have much higher savings buffers, which are really important in, smoothing your living standards during times of economic shocks as we're experiencing now. And I think it's important to note that we show averages, and there is so much variation within groups. And, we might have older age groups that have, huge financial savings buffers. But again, we will have pensioners that unfortunately have very little income, and they're on a fixed income, which makes it even more difficult to respond to these shocks. So I think we're picking up some of that in terms of those proportions as well. So yeah, it's just this huge variation within groups, and I think it'll be really interesting to do some more cuts in terms of age and income. But again, there's problems with sample sizes as well. So yeah, I think that's what we're picking up.
Thank you. Okay, is there anything else people have got as a burning question for Molly at the moment? And if not, then thanks, Molly. I think Open Innovations will want to pick up with you how we can kind of share some of those categories and make it as easy as possible for people to look at how they might consistently reproduce any of this if they wanted to. And thank you. Mark, I'm going to hand back to you in terms of where next.
Yeah, thank you. Really helpful. I mean, it occurs to me, one of the things that we might do as Open Data Saves Lives is almost come up with some set of sort of marking or certification. You could sort of, Molly, for example, puts a piece of work out and we go, it's a 8 out of 10 because she shared this, this and this, but she wasn't able to share this or didn't know to share this or something like that. And some sort of framework that, all the people that are using the data that Sam's helping get for them, you'd almost have this kind of Goldacre score of how well you adhere to the recommendations in the Goldacre review. Are all the definitions national ones? If not, are they published? Is there Resoultion and so on? So that might be some homework for us. Really grateful for Molly and for Sam for speaking today. Our next session, we're going to do something around the issues around virtual wards and how we analyse and how we wrestle with trying to move people out of hospital being still monitored by a clinician at home, what that might mean in terms of outcomes and experience and so on, and actually just some of trying to share some data and recording around how that's done, because as usual, people are addressing it in slightly different ways locally, and it would be really good to make that as kind of reproducible as possible so that people kind of working with Sam can count virtual wards in exactly the same way and say this is exactly the number of them that are geriatric beds and so on, and not argue about the definitions of what geriatric medicine is and so on. So that's a kind of big one, which we'll kind of advertise through the usual channels. very grateful for people coming along. Everything will be written up, everything will be published all through the website. And thanks again to Sam and Molly, and we'll see you next time. Cheers, everyone.
Thank you.
Cheers, thanks.
Bye.